Hello, Lance Turner of ArkansasBusiness.com here again. If you followed COVID-19 and the pandemic here in Arkansas, you are probably aware of ArkansasCovid.com. It's a website founded by Misty Orpin of Springdale, and it really offers a deep dive into the data behind the pandemic spread here in Arkansas. I thought it'd be interesting to talk to Misty about the project, how it got started, and also some of the trends that she's seeing, what lies behind the data that she gathers, how she gathers that data, and also how businesses need to think about the pandemic and what specific data points businesses need to follow in order to understand more about the pandemic. Here is our conversation.
I started as a journalist. I worked for a little paper in Russellville, the Courier in Russellville. I worked for the Benton County Daily Record. I did some work for Arkansas Line. And then I moved into more community type projects. I worked on the Razorback Greenway. I worked with the Northwest Arkansas Council doing trail development in Northwest Arkansas, did downtown development in downtown Springdale. And now I work with my family's business. We have a hard cidery called Black Apple that distributes hard cider around the state of Arkansas.
And now you've developed this little sideline here that is kind of taken over, I would imagine.
Yeah. Well, the cidery was closed and I was watching the press conferences every day, and I was finding that I wasn't getting a lot of the answers that I was looking for through the data that was being released through the state or given out at the press conferences. So I started tracking it a little bit more deeply and then put that information out there for others to use as well.
So speaking of those main numbers, that main dashboard on your website, when you go to ArkansasCovid.com, that's cumulative cases, active infections, deaths, recoveries. So exactly where does that information come from and how are you getting it?
Yeah, all that comes directly from the Department of Health. So the Department of Health now they have a pretty good dashboard that's up there on their website, and they update that every day around 3 or 4 o'clock. And so I pull all that information off of their dashboard and put it into massive spreadsheets that I have. Just everything I use is free, by the way. So like anybody can do this, to big spreadsheets that I use. And then I publish most of those spreadsheets as well. If people want to use the raw data to create their own charts and graphs and do their own research, that's available. But I pull all that in at the same time each day. And then that just feeds a more granular look that I've set up through different formulas.
Right. And you've got all those charts listed out and you're slicing and dicing it in a lot of different ways.
Yeah, definitely.
So what are the challenges of collecting and storing that data? Because stuff seems to change a lot in terms of how the state may collect, how they may categorize certain things. Is it hard to keep up, and have you had trouble obtaining certain information?
I mean, there's definitely data points that we're missing as a state that I think other states do provide that Arkansas doesn't, that I think would give us a better view of what's happening. I haven't had a lot of trouble with the state getting the main things, that they put out there. I do wish they put the raw data out there. I feel like Texas and a lot of other states do put their daily raw data out there in a spreadsheet form so that people don't have to go download mine, because I'm always afraid mine's going to have a typo, because I'm literally hand keying most of that stuff in. And so, so there's some challenges there. I wish the state would make that available to everybody. There are some things like hospitalizations on a county or regional level that I think that we really need. We need better death data. We don't have really good information on deaths from the state. And then we don't count in Arkansas, we don't count suspected cases, hospitalized people that doctors pretty much know they have COVID, but they've tested negative for one reason or another. A lot of states count those in their hospitalization numbers and in their overall positive count numbers, but Arkansas doesn't.
Well, so you watch the governor's briefing every day, like a lot of us do. How do you think he and Dr. Smith are doing in terms of communicating the data? I mean, are they making it clear? This is a tough job probably for anybody to communicate all these numbers. How would you say they perform in terms of just that one news conference every day?
I mean, I think that there are some challenges that they face. I feel like they could do a better job. If I didn't think that they could be doing a better job, I wouldn't be doing what I'm doing. I think that a lot of Arkansans sitting at home hear what they're saying in the press conferences and they don't feel like it makes logical sense to them. And so that's one of the things that I do is I take what they say in the press conferences and I really look at the math of what they're saying and I look at the trend lines that they're citing and I try to figure out, is this actually what's happening? Or is this something that's maybe being skewed so that it fits a narrative that we're being told to believe? And sometimes it is, sometimes it isn't. But I kind of am there to be that balance or that check on what you're hearing versus what your brain is telling you is actually happening. Because I feel like a lot of times our Kansans are at home screaming at their TVs because their logical brain is telling them that the math on that doesn't add up. And so I'm there to tell them the math does add up or the math doesn't add up because I have the data in the background and I can actually run the formulas and check that and then provide, a different chart or a different look at what, the governor or Dr. Smith may be saying. But I mean, they are in a tough position. I wouldn't want to be leading this effort. It's, especially with somebody there Monday morning quarterbacking your every move. It's got to be really hard.
That's right. So what are some key trends then that you are seeing or points of data that you've seen, things that you're particularly interested right now in terms of the data and what is it saying to you?
Well, so I think our testing right now has kind of plateaued, but our new cases have not. So our new cases are going up quite quickly, but our testing has kind of reached a spot where it's leveled off. And I'm wondering if maybe we are at our testing capacity in Arkansas. And if that's the case, then that's not great news because our cases are still going up exponentially. If you look at last week, they went up 37%. New cases went up 37%. Testing only went up 1%. You can see in a lot of counties like Washington County, cases went up quite a bit, but testing actually went down. So there are lots of counties where that's happening. Crittenden County in particular, testing went down by around 50% last week, but its caseload went up, it doubled. So it went up 100%. So there are counties like that that are having those issues. And I don't really feel like we're being told that or that we really have a good handle on where those trigger spots are right now, where we need to be looking.
So I guess that plays into why the governor last week talked about the doubling of the contact tracers. Well, that's contact tracing though. That's a different effort than testing, right? That's two different.
Yeah, it is. I mean, they should be tied together, right? Because ideally, if someone has been in contact with someone who's a known positive, then they need to get tested. There's issues with contact tracing. Clearly, we're not reaching people as quickly as we should. Contact tracing is only useful if you get to those contacts before they've gone out and spread the disease, right? Otherwise, what's the point of contact tracing? You're trying to get that person to quarantine and stay home. We're not getting those people in that time period. We're actually not getting the data that shows that. Like I've tried to get good answers on how long on average does it take for us to reach the contact, right? I can't get a straight answer from the state on that. So I feel like we're behind on our contact tracing efforts, and the 700 contact tracers that we're adding are not actually a full 700 that we're adding. We're actually going to be taking away a lot of those contact tracers that are currently working on contact tracing right now. They're going to go back to their regular jobs. So those 700 coming in, it's not a net 700 gain. They're actually going to be coming in as 700, but a lot of our existing contact tracing force is going to no longer be contact tracing.
You got folks cycling out of that program, I guess.
Yeah.
Okay.
Definitely.
Wow. So there again, details in the data that paint a different picture than what you see
exactly
on a daily basis. We're starting to see what many in Arkansas may regard as regional hotspots. Northwest Arkansas seems to be the key one for now. That could change.
Right.
How should we think about those hotspots in general, since so many people don't show symptoms? We only know what we know about cases mainly through testing and hospitalizations. What does it mean to be a hotspot?
Yeah, I mean, I think in hotspots, you kind of have to assume that everyone around you has it, honestly. I feel like a lot of people aren't showing symptoms or they're showing mild symptoms. Though there's the studies about what asymptomatic really means and how many people actually stay asymptomatic versus go on to develop mild symptoms. Looks like maybe it's the latest study I saw was in a good group that they did. It was around 13 out of 115, or maybe it was 15 out of 113. Anyway, it was like 10% or something like that actually were truly asymptomatic. So a lot of people actually do develop pretty mild symptoms. Kids may be less likely to develop symptoms than adults. And so I feel like in those areas where you know you probably have a high percentage of tests returning positive, so there are going to be a lot of undetected illnesses walking around you, then you really have to take precautions and assume that there are going to be people out there who have it that don't know that they have it.
Has the data revealed anything to you that shows that Arkansas maybe should be doing X, but for whatever reason is not doing that?
What we don't know, so we're told pretty frequently that the data is showing that businesses that have reopened are not contributing to the spread of COVID-19, right? That it's only 2% of people have been to church, 2% have been to a restaurant. Challenge with that is we don't really know what the sample size is of that 2%. How many people have actually responded to that survey? So we don't know how good a sample size we're actually hearing there. So I don't know that we can rely on that. We do know that there aren't a lot of businesses reporting 5 or more active cases that are outside of the poultry industry. So if restaurants or something like that were driving the spread of COVID-19, you would think that more than 5 people at that restaurant that work at that restaurant would have contracted COVID-19 and they would have had to report that to the state. So we can see from that perhaps that's not that it's true that that's not driving new cases. We do know that the poultry industry is a huge driver of new cases in Arkansas, particularly in Washington, Yell, Sevier, Benton counties. It's around a quarter of the active cases in those counties. So we know that that's a huge driver. And what the state hasn't done is they haven't really taken any action on those poultry industries. And so I've always found it odd that we wholesale close down small businesses around the state of Arkansas on the suspicion that they might be driving cases, but we had no data to support that. But the state didn't do anything for poultry industries when we actually have data that shows that they are the driver of new cases in many of our hardest hit counties. I've always found that incongruous.
So in terms of your readers to the site, what questions are you getting from them? I know you're on Twitter. You seem to be having a lot of back and forth there. What are people concerned about?
A lot of people are concerned about where they live. What's happening where I live, in my county, in my city? What's driving the cases here? Is it a nursing home outbreak? Is it a poultry outbreak? Is it, school districts? Right now I'm hearing from a lot of people their concerns about schools starting in the fall. I'm hearing from teachers who don't want to go back to school in the fall because they're worried about their health, they're worried about their colleagues. They don't want to go back, but they don't have any choices. But they also don't see a good plan from the state as to how they're going to be kept safe. So that's what I'm getting right now is it's a really granular down in their communities and really concerned about the next 2 months.
We have a business audience, obviously at Arkansas Business, that includes people who own businesses, people who are key decision makers at their business or nonprofit. What data should they be watching? What things should they keep an eye on when they're trying to make key decisions about their company or their organization?
Well, I think definitely keep an eye on the active cases in your county. Active cases mean a whole lot more than total positive cases in your county because active cases are going to tell you who's sick right now. And sometimes I have issue with active cases because, again, we go back to the data. Recovery determines how many active cases you are, right? We have to know how many people recovered first. Well, the state uses kind of a fuzzy number on recovery. This is another one I get asked a lot. What defines recovery in the state of Arkansas? Well, the state doesn't actually require that someone have a negative test or actually even be contacted to verify that they've recovered from COVID-19. As long as they're not in the hospital or deceased, if it's been 14 days since the onset of symptoms, they are considered recovered by the state. So they automatically just flow through and are considered recovered. But we can assume that they're probably not extremely contagious or walking around at that point. So again, we'll say active cases will probably be the best number for them to look at because then that'll really tell you where your community is right there.
This week, some pastors have expressed concerns about that list the state has made public about places that have seen exposure to COVID-19. Pastors feel singled out because of this. Why not talk about restaurants and big box retailers, places like that? Have you seen that data, and what have you seen in terms of the pros and cons of sharing that information?
So I actually didn't post that. I retweeted someone who did post it because I didn't feel comfortable posting it because I just didn't have enough information about it. I didn't know how good the data was. The state shares lists of places like congregate settings and facilities where people are living, where they're, it's kind of got a residential component to it. And it shares businesses, which also does include school districts. So far as they are a business that's operating. Churches haven't ever been included in that. I've always assumed that churches would be included in that if 5 or more employees at that church were to contract COVID-19. Then they'd make the list for the occupational outbreaks. And so since they've never made an occupational outbreak list, I've never really been too concerned about it. But we do know that a lot of the super spreading events, not just in Arkansas, but around the country have come from churches. So it is a valid thing to look at. But I can see why some people might feel like they're being singled out.
In terms of what's coming up next, obviously there's a daily data dump that you comb through, but what are the things that you're paying attention to going forward here in the next, I don't know, a few weeks, a month?
Yeah, hospitalizations and deaths, I think right now, because we've had this huge increase in cases, I think that that's really the two numbers that we need to be looking at most closely, because that's going to tell us how close we are to getting to our hospital capacity. If you look at what's happening in Houston and in Texas right now, it's really kind of a scary situation. I don't know how far behind them we are. So I'm really going to be watching our hospitalization numbers. Again, I think it's key that the state gives us more data on that at a more local level so that we actually know what's happening. We can see in Pulaski County that their cases are starting to increase. And we had a report just a week or maybe 10 days ago that showed that their ICU was already pretty close to being at capacity, even without a whole lot of COVID cases. So it's going to be really crucial to watch the hospitalization in Central Arkansas and Northwest Arkansas over the next couple of weeks.
If you're looking back on this experience, this is a new endeavor for you. It's still pretty new, right? I mean, since a few months ago, I guess.
Yeah.
What is the thing that you've learned that has surprised you most about this whole situation?
I think what has surprised me most has been the way that Arkansans have responded to it. It's been a very positive response. It's been a very nonpartisan response. I found that, the people who follow the Twitter account and who send me emails and engage with me, it's not Democrats, it's not Republicans, it's not independents, it's not Christians, it's not atheists. It's like the whole gamut of people who just want good information. They just want more information, and they really want to understand what's happening in their communities, because this affects all of us. We are all having to change the way we live our lives right now. And the more information that we have about that, the better. And so that's what surprised me most, has been the way people have kind of embraced the platform and embraced one another in trying to get and share good information with each other.
So what's next for the website? What things are you working on in terms of, I mean, obviously there's a place where people can donate to help you and fund your operation. I believe you got help from the university as well.
Yes, the University of Arkansas has given me an intern named Mary Hennigan, who is amazing. She's a senior journalism student there at U of A. She's really great with Tableau, doing charts, and she's focused on demographics, and in particular how certain demographics in Arkansas are being impacted more than others. You can certainly see that with the Marshallese population in Northwest Arkansas. It's really heartbreaking the way that they're suffering so much through this illness, so much more than other demographics are. So I'm so grateful to Arkansas Soul, which is funding her internship, and donations. I split everything with Mary because she's working really hard on that.
Misty Orpin of ArkansasCovid.com. Thanks for talking to us today.
Thanks for having me. It was fun.
Thank you.